This is a cis videos my patient Julia, sensor 360 check. Mike gonna help to take the video. Thank you. Okay, first I'm just gonna wash my hands and clean my stethoscope. Okay, and I'll go to close the curtains. Hi Julia, my name is C. I'm a nursing student from Seneca College. I would like to do the head-to-toe assessment with you today. That's okay? Yeah. Okay, are you comfortable? Do you want to use the washroom before we start?
I'm okay.
Okay, so I'm just going to start with a few questions. How old are you?
23.
Okay, your age appearance with the stated age and your sexual development is appropriate to your age and the genders. There's no odors. You sit comfortably, comfortable and erect. Your arm relaxed at the side, and also like your body part is symmetry, is equal bilateral, and there's no obvious physically deformities. Can you stand up? Just walk a few steps for me. Okay, and you can sit down. Your gait is smooth, even, and well balanced. While you're walking, well balanced walking, and then your arm swings symmetrical. There's full mobilities with each joint, and then your movement is smooth and coordinated. Your facial expression is appropriate. You make eye contact with me. Your personal hygiene is good. Clothes is clean, and also your speech is clear, and also speech is clear. Okay, so I just want to ask a few questions. Do you know which date is today?
No, I mean March 25th.
Okay, so where are you now?
Home.
Who are you?
Julia.
Who am I? Okay, so your alert oriented times 3 to person, place, and time. Your speech is clearly, and your behavior, you are cooperative and comfortable to answer the questions. And when you're sitting, I didn't notice any respiratory distress. There's no accessory muscles used. And okay. So next we're gonna I'm gonna inspect your head. Okay, so your head, and I'm also gonna palpate. Do you feel tenderness? No. There's no tenderness on your head, and your head shape is round. There's no phallic. There's no deformities on your head, no mass, no lesion, no tenders, and your hair is smooth, is thick. There is no fastitions and foreign bodies. The hair is distribution evenly. Next, I'm just gonna move on your face. Okay, your facial expression looks symmetry, eyebrow, eye, and the nose all symmetry. And I'm just gonna palpate. Do you feel tenderness or pain?
No.
Okay, so there's no tenderness, there's no pain. I'm just gonna check your facial nerves. Can you smell? Okay, show your teeth. Make a frown. Lift your eyebrow and close your eyes tightly and puff your cheek. Okay, so the muscle movement on your face is symmetry. Your facial nerve is intact, which is cranial nerve number 7. Now I'm just gonna move to eyes. Can you remove your glasses? I'll put on the table for you. Thank you. First, your eyes. Eyelash is distribution evenly, and your eyelid is no swelling, no edema. There's no ptosis, no leak-like, and the scleral is white, conjunctiva is pink. There's no discharge. I'm just gonna check your I'm gonna check your cranial nerve number 3, ocular motors. Can you look the distance there? Look straight. I'm just gonna check the size first with both pupils. Okay, so both pupil size is 4 millimeters and the pupil is round shapes. Now I'm just gonna check the light reflection on your pupils. Okay, can you also look straight distance? Okay. Okay. So your pupil is your pupillary light reflection is both reflects to the direct and the concentric. Next, can you focus on this? Look at this, my pen light, and move close. Okay, so your accommodation is intact with pupil constrict and converge. So your perla is intact. Next, I'm just gonna move to your ear, inspect. Equal size bilaterals, there's no lesions, no masses, and I'm just palpate. Do you feel tenderness and the pain? No. Okay, so both auricles and the tragus has no pains, and there's no excessive cerements from the ear. Okay, so I'm just gonna do the whisper test. Can you cover one ears? 1, 2, 3. The other side? 1, 2, 3. Okay, so it's good. You can hear both sides. Next, we're gonna move to your nose. Your nose is in the middle lines. There's no discharge. And then can you just cover one side and take deep breaths? And then move to the other side. Okay, so your nasal passage is patent. There's no occlusions. And then I'm gonna move to your mouth. Gonna wash my hands again. Wear the gloves. So I'm gonna inspect your lips first. Your lips is a pink symmetry. There's no lesions. And now I'm gonna move to your gum. Okay, your gum is pink. Skin. There's no bleeding, no edema. And can you show your teeth? Okay, your teeth is straight, white. There's no looseness and there's no missing teeth. Okay, can you tilt your tongue out? Okay, widely. Okay, so and also I'm also gonna check the top of your. So your tongue is pink. It's a symmetry. And then also your soft and the hard palate is the skin is intact. There's no lesions. Hard palate is white and with a rugae. Soft it is a pink, smooth. And just one more time check. Can you tilt your tongue again? Okay, say ah. Okay, your uvula and the soft palate raise up in the middle lines. And can you just tilt your tongue again? Tilt your tongue out, and then move to side. Okay. So before I check when you say I check the cranial nerve number 9 and number 10, glossopharyngeus and also the vagus that's intact. And this time when you tilt your tongue out, move to side, I'm checking the 12. Cranial nerve number 12, hypoglossal. Can you also say light tight dynamite?
Light type dynamite.
Okay, so there's no tremor and the tongue in the middle lines. This cranial number 12 is intact. Okay, so next one. So I'm gonna move to the neck this time. I'm gonna inspect your neck. So your head is in the center, it's in the middle lines, and the trachea also is in the middle lines. There is no obvious spheroid enlarged. There's no mass lesions, no pulsations. Your neck muscles look symmetries. Okay, I'm gonna palpate. Do you feel tenderness?
No.
Okay. So next, there's no tenderness. Next, I'm just gonna palpate for the carotid arteries, one at a time. Okay, and then the other one. So it's a 68 per minute, and regular rhythms 2 plus or like moderate equilaterals. And then now I'm just gonna check your cranial nerve number 11 spinal accessories. Okay, can you shrug your shoulders? Okay, can you again turn your face against to the side against my hands? Okay, so your cranial nerve, the spinal accessory nerve is intact. Now I'm just gonna move to the upper extremities. Okay, so inspections, your arm looks like there's no, your arms look symmetry, there's no deformities, and there's no muscle involuntaries, there's no mass, no lesions. I'm just gonna palpate for the temperature. It's a warm, it's a equilateral, it's same temperature, same warm equilateral. Do you feel pain, tenderness?
No.
There's no pain, there's no tenderness. And next, what? No pain, no tenderness. There's no mass, no muscle bulk. I'm just gonna check your radial pulse. Okay, 68 per minute, regular rhythms, 2 plus equilaterals. I'm just gonna check your capillary reflection, less than 2 seconds. It's good. And now, can you grab my fingers? Okay, so the strength is equilateral. So let's do the range of motion. So first, your finger, then the extension, flexion, and then your wrist, flexion, and the extension, radial deviation, ulnar deviations, and the elbow flexion, extension, and the pronation, supination. Shrug your shoulders, abduction, adduction, and external rotations and internal rotations. Do you feel any pain, tenderness? Okay, so it's a full range motion on your upper extremities. Now let's check the lower one. Okay. So your lower extremities, can you just move back a little bit? Okay, so your lower extremities is symmetry, there's no deformities, and there's no muscle, involuntary muscle movement, there's no muscle bulk, and there's no lesions. I'm just gonna palpate for the temperature. It's a warm bilaterals, equilaterals, and then do you feel pain, tenderness?
No.
Okay, so there's no pain, no tenderness, there's no lesions, there's no masses. Okay, so now I'm just gonna check the capillary refills on your toe. Okay, so both equilateral, less than 2 seconds. I'm gonna check the pulse on the posterior tibialis. Okay, so it's a regular rhythm equilateral is 2 plus, and then I'm gonna move to dorsalis pedis. So it's equilateral 1 plus. Okay, and now can you lift your toe up with against, this called the dorsiflexion, and then put your toe down with again with the resistance. This is called the plantar flexion. Next one, can you move a little bit? I'm gonna inspect. Oh, you can say that. Yes, good. Thank you. So I'm gonna inspect your back, your thoracic from the back. So your thoracic is symmetry. The spinal is in the middle lines. There's no skeletal deformities, and there's no mass, no lesions, no scars. Just gonna palpate. Do you feel pain, tenderness? No. Okay, so there's no pain, no tenderness, no excessive moisture Okay, so I'm just gonna check the anterior and the posterior ratio. So anterior, posterior, and the transverse ratio. So it's 1 to 2. Okay, next I'm just gonna check the symmetry, chest expansion. Can you take a deep breath in? Okay, good. So your chest expansion is equilateral, it's symmetry. So now I'm gonna auscultate for your breathing sounds. So I'm gonna auscultate the 9 points in each side. Try to avoid the spinal and the scapular. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 9, 8, 9. So I'm gonna auscultate a whole inspiration and rest and expirations. So there's no adventitious sounds like a crackle whistling sounds. I'm just gonna. Can you turn to me again? Facing to me. I'm just gonna auscultate from the front. Oh. We're gonna do from the front. Okay, so your respiratory rate is 18 per minute, and there's regular. There's no adventitious sounds. Can you lie down? I'm just gonna auscultate your. Yeah, lie down. Auscultate your heart all the way down. Yes. Okay. So I'm gonna auscultate the 5 different places. First is left to right. Second, the intercostal space called close to the sternum border called the aortic area. And we move to the left side. Second, the intercostal space called the pulmonary area. So this two is good for the S2 sounds. I'm gonna move to the left side on the third intercostal space. It's called the Erb's points, also close to the sternum borders. And next, I'm just gonna move to also the left side, the fifth intercostal close to the sternum point, sternum border is called the tricuspid area. So this is good for S1 sounds. I'm gonna move to the left side on the fifth intercostal space as well, but it's a mid clavicle line. It's called the mitral area. Here is the apical sounds. So the rate is 68 per minute, regular rhythms. There's no actual heart sounds like S3, S4, or murmurs. Okay, next I'm just gonna, can you, like a lifeline, gonna inspect for your abdominal. So your abdominal is a symmetry, is a little bit a round shape, or like it's a flight. It's a flight, it's a symmetry. There's no scar, no dry eye, there's no pulsation. The umbilical is in the middle lines. So now I'm gonna auscultate. I'll start from the left, the lower, the right lower quadrants, left right upper, and left upper, left lower. So there's a normal abdominal sounds. There is a high pitch. It's like 10 vowel sounds per minute. It's like a gurgling sounds. And also I'm gonna like a palpate for quadrants. Do you feel tenderness? No. Okay, so there's no tenderness, there's no superficial mass, no rigidity. I'm gonna palpate for the bladder. Do you feel tenderness?
No.
Okay, so there's no bladder distension. I finished my assessment.